Hello everyone, this is your Dr. K. Samyukta, consultant urologist and urogynecologist. So one of the other most commonly asked questions to me is, Doctor, what are the most common tests used to detect prostate problems? So the three most commonly detected prostate problems are the benign prostatic hyperplasia or the prostatomegaly, infection of the prostate, prostatitis, and the other is prostate cancer. So most of the tests for all the three of them overlap, but let's go one by one. So talking about the benign prostatic hyperplasia or the prostatomegaly, the most commonly test done is the digital rectal examination, where a gloved finger is kept into the rectum to assess the texture of the prostate, which is present right in front of the rectum. Generally, any hardness or any lumps or any tenderness is generally detected with digital rectal examination. Apart from that, the two most common tests that are done is, one is the serum PSA test, which is nothing but a blood test used to detect something called prostate specific antigen in the blood. Generally, this prostate specific antigen increases in conditions like benign prostatic hyperplasia or prostatitis or prostate cancer. Generally, the value of this PSA is less than 4. Generally, if it is less than 4, there is nothing much to worry about it. If it is between 4 to 10, we generally keep the patient under observation with medications and we repeat the test after some time. And if it is more than 10, then we suggest patient for something called as a biopsy. The next most common test that is done is ultrasound. Ultrasound abdomen and pelvis with prostate volume and PVR, which gives you a gross idea of the volume of prostate that is present, any residual urine that is being retained back in the bladder after passing urine, any back pressure changes on the bladder or the kidneys, and any other underlying causes. Then if you are suspecting a very large prostate with raised serum PSA, generally more than 10, we generally do something called a biopsy. Prostate biopsy is nothing but a small chunk of the prostatic tissue is removed and then examined under microscope for any evidence of malignant cells. Now this prostate biopsy can be done using transrectal route or transperineal route, but the most commonly used route is the transrectal ultrasound guided prostate biopsy. Generally it's a 12 core or a 16 core biopsy, because of which we will get to know if there is presence of malignant cells. The more advanced tests that are done in suspected cases is nothing but an MP-MRI, multi-parametric MRI, or sometimes this MRI is combined with biopsy, MP-MRI plus fusion biopsy. So in this, the abnormal areas are detected using MRI, and then followed by that we can use both the images of MRI as well as TRUS and do a biopsy and remove the tissue from the abnormal areas. Apart from these tests, we also do other tests like uroflowmetry if we are suspecting any decreased stream of urine or interrupted stream of urine or problems in the urinary flow. But talking about prostate cancer or prostatitis or benign prostatic hyperplasia, these are the basic tests that are generally used. Not all the tests are done always, but generally we go with the most common ones. And if we are suspicious, then we go to the more advanced imaging technology. Thank you.